The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everyone. My name is Jackie Leiser. I'm a manager with CAQH Core, and I'd like to welcome you all to CAQH Core's first participant forum of 2023. Thank you all for joining us today. Before we go ahead and get started, I'm just going to go over a few logistics. In order to access the webinar materials from today's presentation, you can go ahead and download the slides right now from the handout section of the GoToWebinar menu. We'll also send an email out to everyone who has registered in the next 1 to 2 business days with our slides and webinar recording. If you have a question throughout the presentation, please feel free to submit them at any time. You can use that questions panel on the right-hand side of your screen where that GoToWebinar dashboard is located. I'm going to run through our agenda and then hand it over to Erin Weber. But before I hand it over, just to give you an overview of today's presentation, we'll start off by talking about the NCVHS hearing that happened in January and provide a summary of just some key highlights from the hearing. We'll also go over current federal regulatory activity, and we'll follow that up with a participant poll asking questions about the proposed prior authorization rule and attachments rule. We'll then close things out with providing you all an update on our operating rule development initiatives for the rest of this year. We'll close things out with a Q&A. And that's about it. I'll send it over to Erin to get started.
Great, thanks Jackie, and thanks everyone so much for joining us today. I am Erin Weber. I am the Vice President of CAQH Core, and know many of you I see on the list, so it's good to see so many familiar faces today. I know some of us are on the East Coast with our windows wide open, with it being 75 degrees outside. And then I've talked to other people today that are in Utah and other parts of the country that have inches upon inches of snow. So I appreciate that we are all experiencing very different seasonal conditions today. As Jackie mentioned, I want to start off today and give you all an update on the NCVHS hearing on the proposed operating rules that occurred on January 19th. And if we move to the next slide, I just want to remind the group the rules that we put forward. The process for CORE to decide which rules to bring to NCVHS, of course, all of the rules are first approved by your organizations as CORE participating organizations. They are developed by the CORE participants, approved through our formal voting process and the all CORE vote. Then the CORE board votes to approve the rules, and then they also consider whether or not the rules should be brought forward for federal mandate. So back in, it was probably almost a year ago, the CORE board met and decided that this set of rules was most appropriate and most meaningful for industry to have federally mandated to help address emerging business scenarios and new business needs over time. So just a reminder, there were several rules that had been updated that were already federally mandated, and that includes the CORE infrastructure rules for eligibility, claim status, and ERA. The updates in those rules included the system availability requirement moving from 86% of the time to 90% of the time, which equates to about an additional 1 hour of uptime per day, which is not insignificant, 365 hours a year. Also includes references to the updated connectivity rule, which includes both SOAP and REST protocols, as well as enhanced security requirements, and the updated companion guide template, which allows for multiple versions of the X12 standards to be used. We also put forward updates to the CORE eligibility and benefits operating rules, in particular data content requirements to address the increasing complex benefit structures, so addressing tiered benefits, letting providers know whether or not a prior auth is required, adding additional service type codes, procedure level codes for particular services, PT, OT, imaging, and I'm definitely not going to remember the fourth off the top of my head. So lots of great updates to the eligibility and benefit operating rules, and also a patient attribution rule requirement to indicate whether or not the patient is attributed to a provider in a value-based payment relationship. So those were all the updates to the existing federally mandated rules. And then with the new attachment operating rules, we included, the board included both the healthcare claim attachments, data content, and infrastructure rules, and similar rule sets for prior authorization. Those of you that worked on the rule development for these rules will remember that the core participants decided very purposefully to make these rules standard agnostic, in part because at the time, CMS and HHS had not yet named an attachment standard, so we were working off prior NCBHS recommendations. So the rules addressed both X12 and non-X12 methods for attachments, creating really uniform expectations around the exchange of those attachments. If we move to the next slide, at the hearing itself, the core board chairs, and that was Tim Kaya, who is president at Optum Now and United Health Group, as well as Linda Reed, who is the Chief Information Officer at St. Joseph's Health in New Jersey, a safety net hospital. They presented to NCBHS, and I joined them as well, on the value of the proposed rules. And we had asked our board organizations to go through an impact assessment on what it would take and what the ongoing costs and benefits would be to implementing the operating rules. So we were really able to share some of the expected costs and benefits and real world workflow impact in that presentation. If you are interested in seeing the presentation or any part of the NCBHS hearing, they have posted the recording of the hearing on their website. So you can go there and watch the full day hearing if you are interested. We did have several core board organizations present as well on the various panels. There was a provider panel, a health plan panel, and a vendor panel, as well as SDOs. And so we would like to thank Aspen Dental, Athena Health, and Blue Cross Blue Shield of North Carolina for their efforts in preparing for those presentations, as well as all of you who spent time and effort writing in comment letters as well on the proposed operating rules. So very much appreciate your work and time there, and we know it was a really busy time of year to be working on that, so very much appreciated. In terms of timeline and next steps, I don't have a solid answer on when we expect a recommendation to come out from NCBHS. I know they are working to schedule their next meeting. I've heard it could be as late as June, but sometime between March and June, we anticipate that NCBHS will make a recommendation to HHS on whether or not the proposed rule set should be federally adopted under HIPAA. And then if there is a recommendation, that will then lead to CMS and HHS to begin the rulemaking process, which I'm sure we're all pretty familiar with at this point. There'll be an industry comment period, and then about 2 years for implementation. It is possible that NCBHS may elect to move forward with some, but not all of the proposed rules. For example, the updates, but not the attachment rules, or a subset of either. So we will just have to stay tuned to see where we end up with that. Building on that recap of the NCBHS hearing and the industry efforts there, as all of our organizations were working on our comments and preparing for the hearing, CMS, and we can go on to the next slide, released 2 proposed rules for comment. The first was the interoperability and electronic prior authorization proposed rule, and the second was a healthcare attachment standard proposed rule. So in particular, that healthcare attachment proposed rule has a lot of impact and relevance to the operating rules, and I'm going to speak on that in a minute. Before I go into the details here, I will say that CORE is working with our board and our stakeholders to draft comments on both of the proposed rules. And I'll share a little bit about our thinking and perspective, and we're going to do some polling as well later in the presentation to make sure we understand your all's perspectives as well, and that is reflected in our letter. And certainly, as you're working on these comment letters within your own organizations, feel free to reach out to us as well to share thoughts or comments or suggestions. You know, we definitely want to collaborate and make sure we're representative of our stakeholders in those comments. So the first proposed rule relates to interoperability and electronic prior authorization. I'm sure many of you remember back towards the end of the last administration, there was a electronic prior authorization interoperability rule that came out that was ultimately withdrawn with the Biden administration. But that rule contained many similar requirements to what is included in this proposed rule, particularly around prior authorization. So the rule requires payers to build and maintain a Part D API, which is prior authorization requirements, documentation, and decision API. And there are other requirements that align with some of the operating rule requirements we have developed over the years for the 278, that payers must include a denial reason. There are time frame requirements around how soon the payer must send the prior auth decision, public reporting requirements for certain mechanisms, and also including measures around prior authorizations for MIPS eligible clinicians and others to have some accountability on the provider side as well. From the interoperability perspective, the proposed rule builds on the interoperability and patient access final rule and requires you know, a number of requirements around patient access, provider access, and payer-to-payer data exchange using FHIR APIs. And for both of these, CMS has recommended the use of certain FHIR implementation guides, but is not requiring their use. Finally, the proposed rule includes 5 additional requests for information, or RFIs, on a wide range of topics, including social determinants of health, behavioral health, improving exchange of information in Medicare fee-for-service, TEFCA, and prior authorization processes for maternal health. I suspect from a CAQH and CORE response perspective, we'll focus mostly on the social risk factor data and the TEFCA questions, as the other topics are a little bit out of our primary focus areas. I'm sure I do not need to tell this group that comments are due March 13th. Both of these rules had a 90-day comment period, which gave everyone a little bit more time with the holidays and everything else that was going on across the industry when the rules came out. On the next slide, I want to highlight, and these are some common themes we had included in CORE's initial comment letter to that rule that came out towards the end of the Trump administration. And many of our same comments, I think, we're continuing to resonate with our stakeholders moving into this proposed rule. The first is concern about the rule program impacts. So that interoperability and electronic prior auth proposed rule, the initial version only applied to Medicaid. This new version applies to all federally funded health plans, including Medicare Advantage, Medicare, exchange programs. So the scope of the rule has increased, but it still does not include commercial lines of business because CMS doesn't have authority in this area to require things of commercial health plans. So we have some concerns about that resulting in fragmented systems and unintended barriers to standardization and interoperability, as you have sort of a bifurcated system in which there are certain requirements on more government-sponsored health plans and then the commercial lines of business may or may not follow what they're doing on that side of the house. So concern from a provider perspective that they may have varying experiences there. Kind of building on that, and this is a theme we've included in our comment letters over the last couple of years, is the importance of applying standards and operating rules across the healthcare industry. So, you know, there is the ability within HIPAA to adopt new and modified standards. And so one of our questions or recommendations is for CMS to think about potentially adopting these prior auth standards through HIPAA so that they would apply to the entire industry and not just government, not just those health plans with the government focus, so that we have less fragmentation. I think, you know, we continue to have concerns around the breadth of the testing of the APIs for prior authorization, and then we'll include some comments as well around the timeframe requirements. I'm sure many of you were involved in the work that we did to develop the timeframe requirements for the 278 operating rules, and those conversations with the various stakeholders were really interesting and informative around the conversational nature of prior authorization and thinking through how we can ensure that these requirements support that process as well. And then moving into the healthcare attachments proposed rule, that rule really covers 3 key areas. The first is standards for healthcare attachments. So the transactions adopted include the X12 version 6020 275 and the HL7 CCDA. And everyone here knows that we have been waiting for healthcare attachment standards for quite a long time. And this proposal is based off of prior NCBHS recommendation. The rule does adopt standards for electronic signatures. There's some technical issues, I think, with the proposed rule language that CMS is aware of and has noted in our core board meeting this week, actually, that they are working to address. And then it also modifies the prior authorization transaction from the 5010 X12 275 to the 6020 version because it better supports the 6020 version of the 275. So making sure that that is aligned. Comments on this rule are due on March 21st, and we are working on those comments as well. I think one thing I want to highlight in particular with this group, and we can move on to the next slide. We talked about this, the board chairs did at the NCBHS hearing, but CMS has been clear that with an NCBHS recommendation on the proposed attachment operating rules, there is the potential for CMS to include those operating rules in the final rule for the attachment standard. So under HIPAA, CMS is required to adopt both standards and operating rules for attachments. And CORE was named the operating rule authoring entity for attachments almost 10 years ago now. So we do think that this is a kind of unique opportunity to align implementation of standards and operating rules so that the industry doesn't have to go through kind of 2 implementation periods. We can just get everything aligned from day one to really accelerate adoption and strengthen interoperability. You know, I'm not going to go over all of the attachment operating rule requirements on this call. There's lots of resources on our website if you're interested in getting into those details. But they will really bring some more consistent expectations around the exchange of attachments, both from a data content perspective to support reassociation, infrastructure requirements, particularly around file size and connectivity, to really ensure that industry is using these standards consistently and driving automation. On the next slide, to support this goal, which the core board really supports as well, We do encourage your organizations to consider supporting the alignment of attachment standards and operating rules in your comment letters as well. We did launch a dedicated website in early February to better explain the opportunity and provide some resources to support your comment letter development. So if you're interested in learning more, there are some model comments up there. We wrote a blog post around this opportunity, as well as there's a cheat sheet kind of going over the main requirements and benefits of the attachment operating rules. So that's definitely something we encourage you to access. I am now going to move into the polling section, and our polling questions really relate to our polling questions really relate to these NPRMs and getting a sense of where your organization is, what are the issues that you truly support, what's causing you a little bit of heartburn. So our first question we'll go ahead and put up there, just getting a sense of are your organizations planning to respond to these NPRMs? It seems like we're hearing a little bit more about the interoperability and prior auth NPRM, more so than attachments, but both are really critical for the industry. So I don't know, Sarah, if I'm not seeing it on my end, but there it is. So we'll give folks a chance to respond. We've heard a lot of discussion as well in the industry around making sure there's alignment between these two proposed rules. It really seems like we're moving towards FHIR for prior authorization, and yet the attachment rule is more focused on the 278 and the CCDA. So these are some of the topics and considerations we know folks are making as they drive through this. I think one of the things we've been talking about with stakeholders is that if we don't move forward with attachments now, and leave the door open for future standards, then who knows how long we'll wait for the next round. We're already, 2 years out from the next presidential election, and that always impacts the timing of rules as well. Sarah, can we go ahead and put up the results? So great, it looks like most of you are at least responding most of you are responding to both, and very few are responding to neither. So let's move on to our next question. We can go ahead and put that up. So as Sarah brings up that polling question, this one is really trying to understand what aspects of the interoperability and prior auth proposed rule is your organization most supportive of, or where, how do we think that they will have where do we think in the industry, which of these requirements will have the most impact? The first option is the interoperability APIs. That's the patient access, payer-to-payer, payer-to-provider efforts, requiring payers to build and maintain that PAR-D API for understanding if a prior auth is required, all the way down to doing the prior auth exchange itself. The recommended implementation, the FHIR implementation guides to support PAR-D, which will ensure that industry is implementing in a consistent way. There's also those timeframes, denial reasons, and public reporting requirements, as well as the requirements for the MIPS measures. So Sarah can probably see how quickly folks are filling this out better than me, but
I'm going to close it in just 10 more seconds.
Thanks, Sarah. I know many of you know Bob Bowman from our team as well, and he is on another call, but I was hoping he was going to join me, so I had somebody to kind of go back and forth with on these. But
I'm going to share the results, Erin.
Yes, please. All right, so it looks like a pretty even split between, and this was, check all that applies. So a pretty even split between the interoperability APIs and the PAR-D API approach. Less so for the MIPS measures, which makes sense. And on the next poll, we're going to ask the similar question, but instead of which are you most supportive of, the question is which gives you the most concern. And unfortunately, we couldn't get down into all the details of what might be causing you that concern, but would be interested in seeing. You can submit a question or a comment as well if you have any specific reasons for your answers here. And I know Sarah's trying to get up the poll. There it is.
Just launched it. Give everyone a few more seconds on this poll. Okay, we're going to close it and I will share the results.
Great, thanks, Sarah. Interested that the time frame denial reasons in public reporting is causing the most concern, and I would love to dig into that if you're able to submit questions under the questions panel. Is it meeting the time frame requirements? Is it getting that very specific denial reason into the response? It'll be interesting to hear where the challenges are there. All right, Sarah, we'll move to the next one. And really the ultimate goal of these rules is to automate processes, right? So the next poll is asking, how effective do you think these requirements will be at automating the prior authorization process?
And of course, give everyone a couple minutes to respond. A couple seconds to respond. Thank you.
And I really should say once they're fully implemented, right? We all know that implementation periods can be challenging and a time of learning, but once we're kind of further down the path, how effective will these requirements be in automating prior auth? And I'd ask you to respond for across the industry, not just for those plan types that are required to implement. So both commercial and government lines of business.
Close the poll, Erin, and share the results.
Please. Okay, so a pretty nice bell curve there. Moderately effective being number one and very effective being number two. So I think that shows some real optimism on the part of the industry. Let's go on to the next question. And this question is specific to the payers on the line. So we're putting you on the spot just a little bit, but how likely are you to adopt the PAR-D, API process for the commercial side of your business? If it's required for, say, your Medicare Advantage efforts, will you also use it for commercial? Or do you plan to?
We'll get ready to close that poll and share the results with everyone.
Okay, so again, pretty mixed. About a quarter of you are saying not at all likely, somewhat likely, and is about half, and very likely is about 20%. And I would also imagine that some organizations are pretty far out from even making that decision. Next polling question relates to the attachment operating rules asking about the requirements here. Which do you feel are most critical to supporting the automation of attachments? Is it that those data content requirements to support reassociation? Is it the infrastructure, system availability, file size requirements, consistent connectivity, or flexibility around the standard agnostic aspects of the rules and the ability to use them across transaction types?
Launch that poll.
I feel like by polling question number 7, Sarah, we'll have this process down pat. And with 7 polling questions, so there's only one more after this.
A few more seconds and we'll get ready to close that poll and share the results.
All right, the flexibility across the transaction types. I know that as you all were developing these requirements, that was really critical because this isn't a transaction necessarily where we are using one set standard right now as an industry. And so being able to support both current and emerging technologies is really important here. And last question, Sarah. Same question here as we asked around the interoperability and prior auth proposed rule, which is how effective, and we'll wait till Sarah gets there, how effective do you think the attachments rule will be in automating attachment transactions? And again, this is, as it's written today. I know in a lot of the research we've done over the years, both on prior authorization and attachments more generally, one of the challenges we've always heard is that without a HIPAA mandated standard, organizations have been really hesitant to make investments in automating these transactions. So I'm curious if having more guidance will drive that automation more effectively.
And I'm going to share the results with you on this final poll.
Okay. So somewhat similar to the question we asked on the prior auth side, everyone's kind of on the fence in the middle here of effective, but not, kind of going to change the world effective. Great. Thank you so much, Sarah. That feedback is going to be really helpful for us as well as we're developing our comments, which the board will review as well. I'd want to spend the last couple minutes highlighting the work that CORE is planning to do in 2023. As participating organizations, you might have noticed that last year we didn't have a ton of work groups and subgroups meeting other than some of our maintenance efforts and some focus group activity. And that was because we had spent a whole lot of time the prior year developing the attachment rules and updating the eligibility rules. So our team really spent last year working with your organizations to identify what the next opportunities might be. And Sarah, if you could bring up slide 23. Every year in September, and we talked about this last fall, our board approves a set of goals for the upcoming year as to what they want CORE to prioritize. And based on the research we did with you all, a few topics came to the top, and we really spent last year further defining the opportunity area. And Sarah, I'm not sure if my screen's frozen, but I'm still seeing the poll results. So slide 23. So you probably have seen some call for participant emails coming out, first for our healthcare claims subgroup. That group is launching either end of March or early April. I'm still seeing the polling results here. End of March, early April. And well, if you saw the CAQH index results this year, or really any year past, we know that the claim transaction is highly automated. I think it's at like 97%, 97% support, or 97% automation. Sarah, we're now seeing your desktop. And so this group is going to be thinking about, in addition to automation, how do we ensure that those first pass claims get adjudicated and approved for payment? You know, we're still hearing challenges around denials and things like that from providers. So some of the things this subgroup is going to be looking at are establishing data content requirements for transactions supporting claim submission, acknowledgement, and error reporting that really mutually help avoid rejections and costly downstream appeals. The group may also consider the application of these requirements to use cases including telehealth visits and coordination of benefits. So our team is really refining those opportunity areas and would love to hear if you all have thoughts on that. And then once that group launches, we'll begin operating rule development for a healthcare claim data content rule. As you know, we have an infrastructure rule already for healthcare claims and the claim attachment rule. So this, there it is. So this data content rule will really complement the healthcare claim operating rule set. The next area we are going to be focusing in is value-based payments. We approved our first set of value-based payment operating rules back in 2020, I believe, with the patient attribution operating rules. We spent a good part of last year updating some of our initial research and hope to put out a white paper in the next month or two, summarizing some of our findings about whether those 5 opportunity areas that we identified back in 2018 are still relevant today, and if there are any new opportunity areas. And a couple key things came out of that as opportunities for operating rules as well, or even industry guidance. So we are looking at the advancement of social determinants of health through the creation of data content rules for claim submission and the benefit enrollment transaction. So some of that work might overlap with what the claims subgroup is doing. And the work may also, that may be some collaborative effort there. We also will continue our code combinations maintenance process as always. We're looking to kind of update some of the documentation and the processes for that this year to always ensure we're making it the most efficient process it can be. Additionally, CMS reached out to us related to EFT and ERA adoption. And for anyone who took the time to read through the comment letters that were submitted to NCBHS on the proposed X12 updates, you probably noticed there were a lot of letters from providers complaining about the use of virtual cards still within the industry. And this has been an ongoing topic for many years. CMS has asked us to think about, from an operating rule perspective, you know, are there opportunities to further improve provider experience and drive adoption of EFT? Things that we're thinking about are updating, in particular, the enrollment data rules to address some security needs, as well as potential requirements around notification for disenrollment in EFT. We hear from providers that sometimes they are disenrolled and they haven't received notice of that and begin getting paid via virtual cards. So looking at some of those EFT, ERA topics and partnering with NACHA on that as appropriate. And just this week as well, our board approved another operating rule development project in collaboration with NCPDP to look at the inclusion of medication eligibility information for those medications that are covered under the medical benefit on the eligibility transaction. So we will be collaborating with NCPDP on a joint rule development effort later this year. So more to come on that as well, because that is really kind of breaking news as the board just approved that. I will stop there and ask if anyone has any questions or comments. I do see one question asking about comment letters in general. CORE posts all of our comment letters on our website. If anyone has gone to our website lately, you may have noticed it looks a little bit different. We are in the midst of updating all of our content there. So some things are a little funky right now, but over the next month or so, I expect it to become much more streamlined and user-friendly and maybe a little less verbose than it has been in the past. So we are excited to roll out that update to you very soon. With that, if we don't have any further questions, I'd encourage you to reach out to me directly if you have any feedback on today's session or on any of the comment letters that we're all working on across the industry, or if you want to get engaged in any of the operating rule development efforts that I mentioned. We're really excited for 2023. I think we already have 3 new participating organizations having joined us at the start of this year. So we're off to a great start, and we are looking forward to working with all of you to help drive efficiency and automation across the industry. Thanks so much.